Hey guys, today we're gonna talk about the important things that you need to remember when it comes to teeth or tooth care for your kids, okay? So we have with us right now, what do you call you? Joshua? Josh, my friend who's a dentist, Tooth Solutions over in along Marcos Highway. That's where my kids go.
LA.
Lower Antipolo.
Lower Antipolo.
That's where my kids go to get their teeth checked. Him and his wife Jimby, they take very good care of our children's teeth. So I have a few questions because one of my kids, Luke actually, he had an accident. He fell face first into a window pane. From the couch.
Okay.
And then we thought it was nothing, but then we saw that his tooth got chipped. My first instinct was, because there was a lot of blood, we have to take him to the emergency room. Emergency room right away. And then I asked you, do we need a cap? Like, is a cap needed?
Because it's a crown.
A crown.
Yeah.
Because I was thinking, it's still baby teeth. So is it that important to put a cap? Like, look at the camera. Show your two front teeth. If you can notice, these two front teeth,
it's different.
they are called crowns, right?
Yeah.
Now, my thinking was, they're gonna fall off anyway. Why do we need these crowns?
So there are many things that you take in consideration. Number one, of course, the pain. There will be pain.
The pain. Okay.
So when patients come to us, sometimes in emergencies like that, we need to take in consideration the pain, the bleeding, everything.
Okay.
Definitely there will be bleeding in the gums.
Okay.
But there will be also bleeding on the teeth.
On the teeth itself.
Yeah.
Okay.
Meaning if
It's your teeth. It's okay.
so usually we ask the patients to take X-ray.
Okay.
If
Which we did, yeah.
yeah. Do if the chip or
Yeah. If it's a big chip,
yeah.
which he had, like his tooth actually really broke in half. Why can't we just leave it alone and let it fall off naturally?
What we say to our patients is there's timing when
Okay.
it comes to teeth eruption.
Okay.
So we check the age. Age is really not.
Yeah, he was 2 years old then, so I was too young.
Yeah. At the same time, of course, aesthetically, there's so many patients now, especially parents, that get conscious with the smile of their babies.
How old should a child first visit a
Alright,
dentist?
so as early as their teeth erupt. So more or less 6 months. So they can go to the clinic, ask their dentist to check them up, and then at the same time we put fluoride. Fluoride is really very important that we really push in our clinic.
Why is fluoride
So
important?
basically fluoride is the vitamins that will strengthen the teeth. Of course, they'll be drinking milk,
Yeah.
and definitely they will not brush their own teeth. In the clinic, we usually teach the parents how to brush. At the same time, put fluoride.
Every 3 months?
Yeah, every 3 months. And then after that, if we maintain the teeth to be really good, it's better than 6 months.
You were saying that when the teeth erupts, obviously the kid will cry. Is there anything that you can put, say, on the gums? Anything to do to relieve their pain? Because I know maybe a lot of first-time parents that the kid may get sick, get the fever. Is there anything that they can do to help relieve the pain?
Yeah.
Sometimes we give up meds, but usually it's really positive reinforcements like encouragements and stuff like that. That's really, with kids, anything new to them will be very, very discomforting. Gifts, new rewards.
Yeah.
Usually gifts after that. And then basically in our clinic also we teach the parents how to brush, how to deal with patients. We have specific positions that we do.
The way it works is that I'm facing him or his wife, and then my kid's
wrapped around
head is on my lap, and then they're working on the mouth.
So for them to be comfortable.
Yeah.
I see a lot of parents say they question like if they should use, say, pacifiers, because they say sometimes that like the
Underbite,
old
overbite.
the old thinking underbite, overbite, or also the teeth get crooked because they use pacifiers.
Yeah.
Is there any science to that, or is it just like, okay, well, people are just bahala na?
Never talaga.
Never.
We usually don't ask the patients to do the pacifiers.
Essie, show it to the camera. Essie's tooth is actually loose right now. So when that happens, it's a baby tooth. What's the procedure? What should we expect will she be in pain, or should we just let it naturally fall? When can we wait, and when shouldn't we wait?
Basically, the first thing, if you go to our clinic, we ask you for X-ray, right?
So even if it's just a loose tooth.
Yeah.
Okay.
Basically, that would be your record. Of course, extraction is a really big no-no.
Yeah, like he took out my wisdom tooth.
Yeah. But with kids, it's really not advisable to say it.
Okay,
really,
they get scared.
Yeah, and may trauma involved.
Yeah. Do you remember when Tito Joshua took your tooth out, or Tito Jimby? Did it hurt? A little bit lang, right? Yeah, well anyways, okay, so for her, for example, if you look at her now, it's loose. Should we see right away, or should we wait for it to fall off?
Usually my wife will tell the parents to just, or tell the kid to just push it with your tongue. Or you can just eat something like a popsicle or a...
We tried. I ate a popsicle.
Because really it comes up naturally.
Yeah.
Oh, it's better for you.
So you can push it with your tongue.
Yeah.
Which is what you're doing right now, right? Now, what if it doesn't work? That's when we see you.
Yes. Yes.
And what happens if we don't pull it out? Like if we just let it, there's another tooth coming out, right?
Usually pwede siyang magsungke.
Yeah. And how about braces?
Right.
How old can kids get braces? Because I know, like you said earlier, is that parents are very conscious of their kids' smile.
Yes.
They want to make sure that perfect teeth, or at least close to perfect. At what age can they get braces?
Usually 15, 16, 17 usually likely. Yeah. As long as the second molars, the permanent second molars are eroded, yeah, we can start putting the braces already.
And for say the adjustments, what do you recommend? Say the quickest to get your braces in, and then the quickest that you can get it out.
Usually in our clinic we usually say around 1 year, 1 year and a half, and then we'll be meeting every month for adjustments. And then after a year and a half, we'll check if it's already okay, and then we take it out and then put retainers.
Okay.
But there's no more headgear, right?
No more.
No more. You look like a nerd.
Because the funny thing, no, it's not funny, but the sad thing now, it's the kids that coming in our clinic who wants braces are the younger ones.
Yes.
Why?
They're being bullied in school
For having
this teeth coming out.
Yeah.
Their classmates were telling them, "Oh, you have big teeth."
So
Then
you
can
don't advise that.
What we usually do, we have this mouth gears that you can put, you can buy, but that's not really comfortable with the patients.
Yeah. It's gonna push your teeth.
Yeah, and there's patient's compliance with it. You need to wear it every night, which is really very hard
for a kid.
Yeah. So we ask them to just be patient and wait for your second molars to erupt, and then after that, you can put the braces on.
And of course, see the dentist every 6 months.
Every 6 months. For our kids, usually 3 months.
3 months.
We usually assess the teeth if it's really caries, or when we say caries, maraming sirang ngipin. We as early as 3 months for
3
us to check. And then again, very important is the fluoride. At the same time with kids, very important. Bagay wife ko pa rin kasi the milk.
The milk.
Very very crucial.
What do you mean milk? Like
the
natural?
Not the milk, the breast milk.
breast milk and
Kasi
natural.
all the kids naman drink milk.
Yes.
So very important because milk really has sugar. Sugar really is the...
So you're saying that milk should be limited, or should it be?
Well, hindi naman limited, but at night when sleeping. Because if you notice the black teeth.
Okay, the black teeth.
That would be the bottle caries. Yeah. The idea is if pag binabad mo yung gatas sa mouth ng baby, definitely the sugar will stay inside.
Okay.
And then after that, the caries will the sugar will attract.
So you gotta be careful about drinking too much milk.
Yes.
Okay.
Milk naman, not
breast milk. Yeah, because
the breast milk naman. Actually, breast milk na sugar din siya.
Oh, really?
Yeah. What ang very important is pag matutulog na yung bata, dapat at least kahit pa paano sanayin na siya na last niya is water.
Oh, okay. So don't let milk be
Because
the
definitely,
last thing.
pag natulog na yung bata, definitely hindi naman sila mag-brush.
Yes.
Yeah.
Make sure na iisanayin sila na
Water's the last thing.
water is the last.
So water should be the last thing your child drinks before going.
Makes sense.
Yeah,
Makes
That's
sense
why we all-
even for like adults.
even for us.
Yeah, make sure.
And
Water.
then, tataba, nakalimutan ko.
Ah, okay.
Ito ko sabi niyo.
Yeah, sa Cody good.
Oh, meron dapat sabihin ko daw.
Okay, sige, go.
When brushing also with your kids, you don't gargle.
Okay,
We don't
that's
gargle.
new information for
Remember?
me. Yeah,
Yeah.
don't gargle, which I do.
So when
the
you
kids
brush,
should.
even in a Diyos sanayan siya, but,
Yeah.
but when you brush, especially with your kids,
Okay, that's very important.
put your paste,
Mhm.
brush, and then spit it out. Keep the fluoride. Kasi parang siyang topical.
Yes.
When you gargle, parang pina-flush.
Yeah, so don't gargle. For kids, even for adults or no?
Yeah, for adults then.
Even for adults, so I'm doing it wrong. Okay, so
I think everyone's been doing
Yeah,
it now.
so-
especially the pea size.
Yeah, the pea size. Kaya may age siya.
Yeah.
0 to 3 years old, pea size. Yung size ng toothpaste sa brush. In our clinic, we have this special brush na maliit yung tip niya.
yeah, we have those.
So basically, ang purpose niyan is you can just, kahit di ba syempre, pag
Yeah.
nag-brush, nagbawala yung kid, you can just put it inside na hindi masasaktan yung kid.
Yeah.
Yung kid. Kasi pa usually yung mga malalaking heads,
Yeah, it's too big for the mouth.
you cannot reach actually
Okay.
the back,
Yes.
which is very important. So
Alright.
pea size, so 0 to 3 goes bigger pag
Pag after
after
kids.
3 years old.
Alright, so do you still need to brush after every meal?
Yes.
Okay, so that's still
2 to 3.
That still is true.
Still makes sense.
2 to 3 times.
Again, this is Joshua. Where's your clinic again?
It's in along Marcos Highway, Tooth Solutions Dental Health Station.
You have an Instagram account.
Yeah, you can find us in Facebook. Usually doon nagme-message yung mga patients natin.
And of course your vlog.
Yeah, I have a
Your
vlog. Yes.
Your family vlog.
So I have a family vlog. It's Puzon Vlogs, that Puzon Vlogs.
Their kid is very, is he? Yeah, he's may anak.
Yeah.
Latest may anak, and he's very, very cute. So again, thank you for joining us today.
Thank you for
We
having me.
learned-
Thank you for having me. Hopefully I helped.
Yeah, we learned a lot. Like I
Yeah.
didn't know that you didn't need to gargle. I forgot about that.
Yeah.
So don't gargle, and remember when your kids turn 6 months or 3 months for some, go visit the dentist. It's going to be not only good for how they look, but also for their own dental care, their oral care, and oral.
Yes.
Yeah. So thank you. Again, subscribe to Dad Squad PH, Puzon Vlogs,
Eric
Eric
Verata.
Verata, Coach Chappy. Thank you guys for watching. Again, if you have any suggestions or comments, comment section. We're gonna link all of our accounts over in the description as well. See you guys next time. Bye.
Bye.